Well, I've been doing clinical practice for about 25 years now.
Okay.
And Clubfoot has always been a strong interest of mine. The first 10 years of my practice, I was doing clubfoot surgery like I was trained to do, open surgery, posterior medial release, taking the foot apart and putting it back together again. And then in 1997, something very interesting happened. In 1997, I had a chance meeting with Fred Dietz from the University of Iowa. And Fred was one of Dr. Ponseti's colleagues. And the Ponseti method is something that I had known about and heard about. All of us had. It's been published in the major journals, but nobody really believed it. Nobody paid it any credence. No one really, was actually practicing it, except the people in Iowa. So I asked Fred, who I consider to be a supremely honest individual. I said, Fred, is this stuff really true? Are you able to treat club feet without open surgery? And he said, absolutely. We never operate on the feet in Iowa. And I was intrigued, and I picked his brains for about 2 hours, and then finally I said, Fred, I need to come out to Iowa to learn how to do this. And he said, well, we don't have that many patients on a given time. It's kind of worth the trip. Just, read Dr. Ponseti's book. He just published this book in 1996. So I bought the book, I read it 3 times, and then I started applying it to my practice.
Okay.
And after I've been doing it for a year, I was getting amazing results. All of a sudden, I went from operating on all my kids with club feet to operating on practically none. We got our operation rate from 95% down to 5%.
Wow.
And so I was very impressed, and I called up Dr. Ponseti, invited him out to be a guest speaker at the Maryland Orthopedic Association. I assembled my first year's worth of patients in the clinic, and then we went from room to room, and he examined all my patients. And at the end, he was impressed. He said, you're doing a good job. He gave me his blessing, and that's the beginning of how I got involved. And I've been going to Iowa for refreshers and going to courses here, and I've been started teaching courses and organizing seminars in Baltimore. And when I travel internationally on my mission work, I try to teach the method to the local surgeons wherever I go. Right. So I feel very evangelistic about it because it's something that's really changed my practice and changed the life of my kids. Well, from my visits here to Iowa, I saw the models being used in the courses here. And then when I started organizing courses in Baltimore for the people on the East Coast, I went to John Mitchell and said, can I buy the models? And he was very kind to supply them to us. And we purchased a bunch and we started using them in our courses. And when I travel overseas, I take some of the models with me so I can teach the doctors locally how to do it. The models are great. They're, without that, you just can't teach it. It'd be one thing if you had, 50 kids in a clinic and you could do it on live babies, but that's not really practical in the United States. So having the models is really a great teaching tool.